Hello, I am Dr. Khalilah Jefferson, DNP. I am a board certified nurse practitioner. I created this channel to share healthcare education, professional insights, and information about the nurse practitioner role. Here you will find discussions on preventative care, patient wellness, and nursing leadership. Thank you for being here.
Why I became a nurse practitioner. When people ask me why I became a nurse practitioner, they often expect a dramatic moment, a single patient, a crisis, a calling that arrived fully formed. The truth is quieter and more enduring. I became a nurse practitioner because I learned early on that healthcare is not just about treating disease, it's about witnessing humanity at its most vulnerable and deciding to stay. I didn't start my career chasing a title, I started it chasing understanding. As a nurse, I was at the bedside when the room was still, when the questions came out at night instead of during rounds, when fear sounded like anger and silence meant resignation. I learned quickly that the most important work often happened when no one was watching. But I also learned something else. I learned that knowledge matters, not in an abstract way, but in a very practical one. Knowledge determines whether you reassure or escalate, whether you educate or dismiss, whether you intervene early or apologize later. I saw how deeply patients trusted us. They didn't just hand over their symptoms, they handed over their stories, their trauma, their hope that someone would take them seriously. And I wanted to be someone who could meet that trust fully. Becoming a nurse practitioner wasn't about leaving nursing behind. It was about expanding its reach. Nursing taught me how to listen. Advanced practice taught me how to act. There is a moment in nearly every patient encounter where the plan could go in two directions. One is efficient, the other is intentional. One treats the problem, the other treats the person. As a nurse practitioner, I have the privilege and the responsibility to choose the latter. I chose this path because I wanted to sit at the intersection of science and compassion, to translate complex medicine into human language, to advocate when systems are loud and patients feel small. I chose it because I saw gaps in access, in equity, in understanding, and I knew I could not unsee them. Let's be honest, our healthcare system does not always reward presence. It rewards speed, productivity, documentation, but healing does not happen on a stopwatch. Patients don't remember every lab value. They remember whether you believed them, whether you explained what was happening, whether you stayed. Nurse practitioners stay. We stay long enough to notice patterns, long enough to catch what doesn't quite fit, long enough to ask the extra question that changes everything. I became a nurse practitioner because I wanted autonomy, not for authority's sake, but for accountability. I wanted my decisions to reflect my values. I wanted to be responsible for outcomes, not just tasks. And yes, the path was demanding. Advanced education requires sacrifice, time, energy, balance. There were moments of exhaustion and doubt, moments when the weight of responsibility felt heavy, but there was also clarity. Every level of training sharpened my understanding of how deeply social factors shape health, how race, income, trauma, and access are not side notes, they are central, how treating hypertension without addressing stress is incomplete, how prescribing medication without education is insufficient. Becoming a nurse practitioner gave me the tools to practice whole person care, not as a philosophy, but as a standard. I did not become a nurse practitioner to replace physicians or compete with anyone. I became one to complement a system that desperately needs collaboration. Healthcare works best when expertise is shared, not guarded, when hierarchy doesn't silence insight, when every discipline practices at the top of its training. Nurse practitioners are not a shortcut. We are a solution grounded in evidence, outcomes, and trust. And perhaps most importantly, I became a nurse practitioner because representation matters. Patients deserve to see providers who reflect them, who understand their cultural context, who recognize when a symptom is being minimized or when a concern has been ignored for too long. When patients feel seen, they engage. When they engage, outcomes improve. This is not idealism, it's data. At the end of the day, this role is not about what I can do alone. It's about what becomes possible in partnership with patients. I don't have all the answers, but I know how to ask better questions. I know how to listen without interrupting, to educate without condescension, to lead without losing empathy. I became a nurse practitioner because I believe healthcare should be rigorous and humane, precise and personal, evidence-based and relationship-driven. Because healing is not just a clinical outcome, it's a human experience. And because every patient deserves a provider who is willing to meet them where they are, walk with them through uncertainty, and use every ounce of knowledge and compassion to help them move forward. That is why I became a nurse practitioner. Not because it was easy, but because it was necessary.